I'm here with Miss Chesney, and if you want to introduce yourself, what you do, what you used to do.
Okay, I'm Rachel Chesney. I currently teach at Coppell High School in the health sciences, primarily medical assisting certification. And I used to practice as a medical assistant, first in family practice and then 16 years in OBGYN.
Okay, and so with that, how does type 2 diabetes impact pregnancy in terms of maternal and fetal health during pregnancy?
Well, so we test women at approximately 26 to 28 weeks for what's called gestational diabetes. So they come in, they drink a glucose drink, and then the hour later they get their blood drawn to see if they have gestational diabetes. And if they do, it is a precursor actually to possibly developing type 2 diabetes later in life. But our primary goal is to treat them while they're pregnant to get their blood sugars under control if they do have it. So if they come back testing positive for gestational diabetes, then we send them to a nutritionist where they learn how to eat like a diabetic patient would to help control their blood sugars. We teach them how to monitor their blood sugars because having untreated gestational diabetes can cause a lot of health problems with the baby as far as their ability to regulate their own body temperature. They can gain too much weight and have kidney problems and other blood sugar related problems themselves because of their mother's blood sugar. And then the infant is also predisposed to developing type 2 diabetes later in life as well if it's uncontrolled.
Okay, and can you discuss some of the potential complications and risks that are associated with type 2 diabetes in pregnant women, and then how they're managed in an OBGYN setting?
Well, like I said, that we would, if they did test positive for gestational diabetes, then we would teach them how to regulate their diet, monitor their own blood sugars, so that that we can prevent the side effects. So if they were to have it and untreated, then like I said, it causes those problems with the baby, and then we might have to take the baby too soon if it's too large. Or take it early if it's too large and manage their sugars that way. But it can cause a lot of heart problems. Any problem that it can cause in a type 2 diabetic, it can cause in an infant as well, or in utero and then after birth.
Okay. What are like specific considerations taken into account for like during delivery of like during a pregnancy?
So we would have a team of neonatal specialists there ready for the baby's delivery, and again, it would depend on if the blood glucose was monitored and controlled while pregnant or not. But either way, we would need to make sure that we are checking that baby to make sure that its kidney functions are doing well, that its heart is doing well, making sure that it can regulate its own body temperature, watching the mom for her blood glucose to go up or down irregularly as well during delivery, because it's all a stressful time for both mom and infant that is during delivery. So we want to just make sure that everybody's blood glucose is doing well, but the baby is the primary risk. We want to make sure it's cleared the mother's placenta and blood supply, the nutrients it's getting from the mom, that we clear that well, and then monitor the baby's glucose after that.
Right. What role does the OBGYN play in coordinating care with healthcare professionals?
So an OBGYN physician would, they generally have doctors that they specifically like working with in each type of specialty. So they'll have endocrinologists, nutritionists, and things like that that they like to work with in general. And they would monitor the mother's blood glucose and then, if necessary, refer her to a specific endocrinologist or nutritionist, sometimes both. Sometimes just a nutritionist depending on the levels of the glucose on the testing. But then the physician would then assign the medical assistant to transfer over any pertinent information like lab studies, patient's medical history and such like that, transfer over to the specialist that's going to be seeing that patient and coordinate care through them. And then coordinate the appointment times with the patient to make sure that they can be seen in a timely manner and realize that it is something you can't put off. You need to take care of it right away.
Yeah, absolutely. And And then what are some insights on the long-term effects of type 2 diabetes on both the mother and the child after the delivery?
So the primary goal would be for mother and baby would be making sure the glucose levels come back down to normal, because it does take the body time to re-regulate itself. So even if a mom had controlled their blood sugars while pregnant, they did well on the diet, followed the nutritionist advice, there's still going to be time that the body is going to take to come back to normal. So we would teach them that you still need to monitor your blood sugars, you still need to eat well, and then just follow the blood sugars and make sure they stay regulated before you go back to just eating how you had prior to it. And then the same with the infant, but it doesn't last as long in the infant as it does in the mother as far as regulating the blood glucose after it's born. But it's still something that has to be monitored. And then, like I said, if they don't monitor their diet during the pregnancy, then the side effects can be much worse. It could take a lot longer to recover for the mom's perspective, but then the side effects can be much worse for the infant, because like I said, it can cause kidney problems and heart problems, and regulating body temperature, and all of those can come into play. And then long-term untreated diabetes in any form, whether it be for the mother or the infant, can lead to gestational or to type 2 diabetes later in life instead of just during the pregnancy.
I see. And then what are like ongoing monitoring and support like systems that are provided for post-delivery and like at-home care?
Mm-hmm. So post-delivery and at-home care, they would still have a glucometer. They would still log their blood glucoses certain times a day, usually in the morning and at night, or before each meal. They would do that and log that. So they would have a journal to log their blood glucose. They would have the glucometer to measure that, and then they would still have access to a nutritionist and to their physician. But we would highly recommend that they keep up with their nutritionist to make sure that they are following a healthy diet.
Okay, that's all.